I've been a rural practitioner in Clearwater, which is north of Kamloops, for almost 30 years, 30 years in June. I think one of the things I like to think about is the vision statement of the Society of Rural Physicians of Canada, which is excellent healthcare close to home for all rural Canadians. And looking at it from that perspective, then access, of course, can interfere with that in a variety of ways, including access to excellent care, because the excellent care is somewhere else, access to physicians in general or other healthcare providers, difficulties with transportation, care that's provided distantly that could be provided home through the use of either extenders of physician extenders and such in the community, or healthcare providers coming from a larger center. So for instance, in BC it's a NEDOP program which allows specialists to visit rural communities and provide specialist care within the rural communities. The other challenge related to specialist services, things like physiotherapy and occupational therapy, speech therapy, social work, and such like that. In smaller communities, these services are not available, and it's very challenging for some patients to get a connection to them. There's a variety of ways of improving that. One is, of course, simply to use virtual care provided via video conferencing or internet or what have you. The other aspect of care, of course, is access to healthcare providers. What we value in healthcare is particularly in primary care, is longitudinal relationships and a broad scope of practice. This is what's important for healthcare in rural areas. And sometimes this is difficult because of a shortage of physicians, shortage of other healthcare providers, but not only a shortage, a rapid turnover. So when a patient has to establish a relationship with a healthcare provider and is comfortable in discussing their healthcare issues, and the provider then moves on somewhere else, this is quite challenging to develop a relationship with a new provider. When we look at this in a larger context, there's a real shortage of physicians that are willing and able to practice in rural areas, and we spent some time today discussing how we can improve the production of physicians, but also other healthcare providers that were keen to go to rural areas and able to practice there to the full scope of their skill set. And there are such things as encouraging rural students to go on to higher education, to encourage and support rural people in going to medical school and doing family practice residencies and specific rural training. We recognize the importance of careful selection of our medical students so that they're fit for that purpose, fit to go to be a generalist and able to practice in that setting, but not only able, but also enthusiastic to work in a rural community. There's so many aspects of how we encourage people to do that. And the most important one is training in those settings. And so, in so much as how we select students in our training programs and where we train them is of vital importance if we're going to continue to have adequate numbers of healthcare providers in rural communities. In the absence of large numbers of particularly physicians, then we truly need to be working in a team fashion so that everyone is working to the full scope of their practice, that patients know where to go, that all doors lead to the same place, in the sense that when we talk about patient medical homes, we're really talking about a setting where all patients know this is where they get their medical care, this is how they get their medical care, whether that care is being provided by a nurse or a nurse practitioner or a physician or a social worker. That care is all provided in a place that they recognize and that's connected, and that they don't need to have difficulty finding out where to go and when to go.
Again, I think with things like the patient transport network and I think they've made some great changes, including having nurses that help with kind of that clinical decision making, and they also tend to have a bit more awareness of the geography of the province, which is great. But I think we need to do more and do better, and we need to have more access to emergency like transport vehicles like planes and helicopters and different things, so that it doesn't matter if we have one critical case in the province or 10, but we can get them out if it's deemed that is absolutely necessary and needs to be done as soon as possible. So we need to improve our partnerships with other services and agencies so that we can have access to those vehicles when we need them. We also need better trained paramedics to be able to man those crews, so that the only nurse in a community doesn't have to transport out with a critically ill person. So I think those things are really important in this area. I also think that we need to increase the understanding of people from more urban centers and rural areas. So back and forth. So I think rural physicians and other providers need to understand the context in urban environments and what they're dealing with, but even more so, I think the urban areas and specialists and that need to understand what it's like to work in Nelson or Fort St. John or Smithers, and I think the best way to do that is to have them physically go, even if it's just one time, but so that they can see how remote, they can see the emerge room, they can see what kind of resources we have and what kind of resources we don't, so that when I'm stressed to the max because I have a critically ill infant or other patient and I'm calling somebody in Vancouver and they ask me to call in the pediatrician on call, that I don't have to waste time explaining that they don't exist, that I am the only one there. And so I think by helping to foster those relationships and help build understanding of context, I think that when I call, it can just go so much smoother, so that we don't have to hash out things that are pointless and just waste time when I have somebody who really, really needs urgent care.
I'm a rural family physician, a generalist physician, a technology-enabled generalist physician, and I'm also a health services researcher. I believe that the advocacy that we do can be strengthened remarkably by focusing more on the evidence that underpins the advocacy. The positions we take should be increasingly evidence-based, and that will support better policy. This aligns well with what the ministry is doing in moving towards a more evidence-based and research-based culture, and I think that it's an opportunity for us to move forward. I think that much of what we do currently is based on instinct, based on common sense, and mostly works. Rural, I think, has suffered over the years an erosion of services, and it's probably not that anybody's dismantling rural, but rather that it's not being attended to adequately. And I think if we focus on the evidence that underpins rural health services, we can do a better job. And I think I know how we might be able to start. The first few steps in that sequence. I think we need to measure what we're doing. And the way to do that is through creating population catchments around rural communities and looking at the outcomes. And where innovations are working, where the system is working well, will become rapidly apparent. The first step in understanding whether a population is being well served will be looking at the utilization patterns. And if an appropriate part of the population is getting their services locally, and if generally the population is accessing services that make sense for the demographic profile of the population, then that service is probably doing a good job and should be recognized and emulated. If, on the other hand, utilization patterns suggest either selective underservice or inadequate services, then that's a population that should be supported. So utilization, rather than the determinant of services, becomes the first layer of outcomes. This fits into what I would call a framework of natural laws of health services that underpin appropriate and sustainable services for rural communities, and something we don't understand well and should understand much better. We should be able to look at a population, look at its demographic characteristics, look at its the distance from the next community where services could be provided, and we should be able to come up with a service profile that would serve that community. A service profile based on technology-enhanced generalism with adequate access to specialists both locally and away. I think this is a strategy for action that we should adopt and implement, as I think the future will be better and better if we do that.